ओके फिर दिस इज़ मालर रैश, जो मालर रैश है इसको बटरफ्लाई रैश भी कहते हैं। एंड इसमें हमारे पास स्पेसिफिकली अंडर द आइज़ एंड ऑन द चीक्स, सो दिस इज़ वेरी स्पेसिफिक। इसमें एसएलई या लूपस की वजह से ये होता है, सो वी रेफर टू लाइक रूमेटोलॉजी एंड because it does have an autoimmunity factor, so we can give like a mild steroid like hydrocortisone, and we advise sunscreen. Okay, so this is angular chelosis. We can see यहाँ पे ये जो the areas around the mouth at the angles, so there's we can also sometimes see fissures. इस picture में fissures नहीं है, but we see extreme dryness. So this is due to deficiencies including B3 की deficiency, iron की deficiency, and vitamin C की deficiency, and ये winters में हमारे पास ज़्यादा होता है. And so इसका जो treatment है, that is of course we're gonna give like treat the malnutrition, so we're going to give multivitamins, we're going to but then the non-pharmacological is we're going to use lip balm, ask them to use lip balm and Vaseline because it's very dry, and we're going to give leafy green vegetables, and it can have a fungal element too, so we can give like a mild topical antifungal, but oftentimes हम नहीं देते. So we know that this is herpes simplex. Herpes simplex में अगर हम इसको describe करें तो it's at the maculocutaneous junction. It's crops हैं, crops of vesicular eruptions, ठीक है. In जैसे chicken pox में ये होता है, इसका supportive treatment होता है. And then the first time that it happens, we can give oral acyclovir, right, which comes in either 400 or 200 milligrams की dosage, and then when it's recurrent, we just give topical ones. So it comes due to stress. So we're gonna ask the patient to try to de-stress, and इसका जो diagnosis है, that is herpes simplex, HSV1. Okay, so this is a scalp. This is a pediatric scalp. It isn't extremely obvious, but this is like called cradle cap. This is what the diagnosis is, right? And cradle cap के जो underlying वो है, that is इसमें seborrheic, right? So it's a kind of seborrheic dermatitis. And इसमें जो होता है, this is due to like when moms they come and वो अपने बच्चों को टोपियाँ पहनाती हैं ना, तो it's due to cap wearing, ठीक है. So this is like a fungal infection, a mild fungal infection, right? So इसका जो तरीका है to treat it, that is to use 100% a cotton cap, and then 3 times a week we bathe the baby, and then we use Vaseline or oiling to massage and loosen the scales. So these are like scales, and we give an antifungal shampoo like Gonas, and we tell them how to sort of avoid the shampoo in the baby's eyes. So ये usually self-limiting भी होता है. तो if you just describe it in one word, it's a seborrheic dermatitis which presents with yellow greasy scales on the scalp, usually self-limiting, or usually appears in the first weeks or months of life, and it's thick, greasy, right? And it's not, बच्चे को irritate नहीं कर रहा होता, they're not like screaming or crying because of it. And so what is seborrheic dermatitis? इसको भी हम लिख लेते हैं. So what this essentially means is that it is this basically means it's chronic, it's relapsing, inflammatory, and it affects places of sebaceous glands, ठीक है. And इसमें क्या होता है कि overgrowth हो जाती है of this fungus that normally exists, ठीक है. And that fungus is called Malassezia yeast, right? Just added information, ठीक है. Okay, so then if we look at these are this diagnosis is carbuncle. So everyone knows what a carbuncle is. I wrote this down. So it's a carbuncle. So this is the way you describe it, is it's on the nape of the neck. It's clearly pustulous. So it's erythematous, it's pustulous. It looks like it's draining pus, and it's big and palpable. It's a bulgy swelling, and upon pressing, pus will drain from multiple points, so like a sieve. So we have to do incision and drainage because the pus is just like it's really painful for the patient, so we have to do um, incision and drainage, and then we let it heal as an open wound, and then we dress it, and then we treat the underlying cause, which is, so it's basically in hairy people, so we can ask them to get laser treatment, or obese persons or people with less hygiene or diabetes mellitus, so we counsel them accordingly, and then we give like augmentin. And augmentin can either be इसकी दो होते हैं 1 gram, which is per oral for 2 weeks, be twice a day, or then thrice daily if it's 625 mg, but that's harder, so we usually recommend 1 gram की जो dosage है, right, twice daily. Okay, so if we look at this, this is basically this is herpes zoster or shingles, and herpes zoster, which is shingles, is like a complication of herpes zoster, and this is specific to a specific dermatome, like it's due to immunocompromised or stressed, and इसमें हमारे पास neuropathic, neurotic, and this should be neuropathic pain is a complication. So we tell them to keep this person away from kids and pregnant people, and we give oral acyclovir 800 mg 5 times a day, 4 hourly in the daytime for 2 weeks, right? Okay, so then the last slide is basically these lesions. So we can see that they're kind of similar. So we see this is hypopigmented, right? Because the skin appears lighter, but this is because this is a dark-skinned individual. But if it's a fair-skinned individual, these patches would appear to be darker. And इसका जो diagnosis है, that is pityriasis vesicular, right? So what does that mean? It means that जो है, this is a fungal infection, and it's very mild, but it's usually self-limiting, and it's usually even asymptomatic, but it can be itchy. इसमें थोड़ा सा autoimmune feature भी present हो सकता है, जिसके लिए हम topical anti मतलब corticosteroid दे सकते हैं, but we usually give calamine lotion, and calamine lotion we know is just an antifungal, or Head and Shoulders का जो shampoo है, and then we can give Salsin Blue Solution 2.5, which has salicylic acid in it. I think I misspelled this. It should be spelled like this. So it's pityriasis versicolor, right? ठीक है, उसके बाद we have this. So this is like a Christmas tree appearance, right? I should have done this in green. These are blacks or patches, because there are some that's more than, some are flat, some are raised, and right. It's erythematous, it's hyperpigmented, it's palpable, and इसका जो diagnosis है, that is pityriasis rosea, right? And जो कि हमारे पास start करता है with one patch, which is called so it starts with one patch, ठीक है? और जो one patch होता है, this is called Harold's rash, right? And it becomes Christmas tree pattern, ठीक है? And इसकी भी is pityriasis. Let me just, sorry, my spelling. Rosea, ठीक है? So these are both pityriasis, but they're different forms.